We are in record mode.
Okay.
Okay, first, Commissioner Barksdale, I'd like to make a motion to have Commissioner Alyssa McKenzie chair our meeting as the only other elected commissioner that we have beside the chair is the secretary. So I make that motion.
Second. Okay.
I'd also like to follow up and make a motion to approve the minutes and thank you again for the level of detail that you put into it.
Jen Eielson, Director of Health. As you see, for the viral respiratory diseases are winding down and the reporting for DPH on that will be winding down. So this will be the last report with those charts in it. Environmental health, we're still trending high with the building permits, especially now that it's our spring busy season. The farmers market, we're almost done with all those permits. That will begin on April 20th. We're sending out the pool relicensing information next week with the instructions for OpenGov. All the pools have to be inspected and relicensed prior to opening for their season, which typically begins on Memorial Day weekend. The salon relicensing will also be going out in the next coming weeks, and that has to be done by June 30th, all inspections and relicensing. FEP grant, Nick and I both attended an all-day training with Voices Center for Resilience on March 12th at Grace Farms. Russ Kimes was also there. That training was on a victim-centered approach to immediate, short, and long-term needs of mass violence and other tragedies. We're doing a training Region 1 on April 24th at Fairfield University with the Fairfield County Trauma Response Team to learn about EMDR therapy and coping strategies to deal with severe stress and trauma. I submitted the FEP financial budget report for reimbursement. Immunization grant, the media campaign just ended on March 31st. I should be getting the analytics from both vendors in the next week or so. So I'll have that for you guys for the next report and how many clicks, likes, so all that jazz. That's Q2 financial report for the immunization grant was also submitted to the state comptroller through Core CT. Our community health updates. We're planning for May is Mental Health Awareness Month. So we're planning an event at Waveney House for Monday, May 13th with 2 guest speakers. Devin, who's an LCSW with the Mindwell, founder of the Mindwell Center, and Kimberly Morgan, who's an APRN board certified. The topic is unraveling anxiety, building resilience and healthy coping skills. We just put that out this morning through Deanna's newsletter as well, the First Selectman's newsletter, and on social media. So we're hoping to get a good turnout on that. Our QPR suicide prevention trainings continue. The next one is on April 19th at the library. We have an Earth Day event planned on Earth Day, obviously, Monday, April 22nd. Shannon will be speaking on environmental health, public health code things that are built in, like wells and septic and that kind of stuff, and protections to the groundwater table and things like that. Our DPW director, Tiger Mann, will speak on recycling and green initiatives that the town does. And we're doing this in partnership with Robin Bates Mason from Planet New Canaan nonprofit. She's also on Conservation Commission. And so they'll be sponsoring the brunch part of the event. And I should add that the New Canaan Community Foundation is sponsoring the brunch of the mental health awareness event. So we're very appreciative to both for that support. The diabetes blood sugar screenings continue both at Lapham and at Schoolhouse. We also had a heart health event at Lapham on March 22nd. The next topic is de-stressing your routine. The childhood food allergy awareness, that had to be moved to the Y, and in all the confusion, we lost more than half of the registrants. So we're redoing that again on Thursday, May 9th, this time back at the library and at 4 PM. So hopeful that more parents would be able to attend that as well. I also added in the typical charts that you all like, and I also sent the suicide data that was just released by the Regional Suicide Advisory Board. And I think it's important because that data tends to correspond to what we're seeing with the ED graphs here, with the age groups of most concern. So
Commissioner Barksdale, thank you very much for the charts you put together. Page 6 and page 7, I just had a quick question. I think we're going to be talking a little bit about mental health since it is mental health. Just want to make sure that I'm clear. The first chart on page 6 is suicidal ideations over the last 90 days, correct? So that adds up to 14,
mhm.
right? And then you get down to the page 7, which is the suspected overdose,
Mhm.
right? Are those two related? Is this a subset of the suicidal ideation, or are these just considered
No.
overdoses?
They're separate things, but they can be coded in the hospital with both. So
Okay,
someone can, to answer that question, someone can OD intentionally and then it's counted as
as a
both.
suicidal ideation. Okay,
Mhm.
so, okay, got it. And then the last one is the New Canaan marijuana cannabinoid. Cannabinoid, okay, good. Learn a new word every day. I guess it's good I don't know what it is. Anyway, so overdoses, is that a?
Most of
also-
those are unintentional. Most of those are, you know, depending on the age group, sometimes it's kids get into their older brothers, and then with the older generation, sometimes they don't understand you're not supposed to eat, you know, the entire chocolate bar if it's an edible or something, you know. So most of the marijuana ones, from what we're told, is unintentional.
So the Surgeon General doesn't put a stamp on the edibles?
Well, there's directions,
That was
but
a-
people have to read and follow. And everybody has different tolerances too.
Right.
I have a question to Tom Ferguson. Do we have any idea for the suicidal ideation? Whether that's the tip of the iceberg or whether we're collecting most of the situations where people have.
It depends on what you're talking about. If you're talking about my charts here, these are only associated with people that end up in emergency room.
Well, okay,
The data that I sent you yesterday of 2022 and 2023,
Yep.
that's data that's collected from various sources of, which is why it was important to see that data, because there's so much focus on younger children. But if you actually look at the data, that's not where
mhm.
the actual, you know, suicides are occurring.
But there is a difference just for between suicidal ideation and actual suicides, which is, I think that the data that is there, that are successful.
Lesher, Commissioner, is New Canaan still part of the Norwalk reporting group for the state in this suicidal report?
Which report are you talking about?
And used to be part of Stanford, I thought. I'm just looking to see.
I think he's asking.
The
is,
report
are
that
we
I sent you
considered-
yesterday?
Are we considered
That
Region
hasn't-
1?
It has it broken down by every town in there.
But I didn't see New Canaan.
Yeah, well,
It
it's,
is.
New Canaan is not in there. When no
Ah,
actual
okay.
suicide,
There wasn't any actual suicide in 2022 or
but just
2023.
suicidal ideations and
Wow.
overdoses and things,
Right.
but none actually
But yes,
successful.
it's all Region 1, but it breaks it down by town and
Right.
On a grander basis, are we still part of the Norwalk Health catchment area for the state? I'm fine.
I guess he's asking what constitute Region 1, and I think Norwalk
Region
is.
1 is 14 towns,
Right. Yeah, I
from
understand.
Stratford to Greenwich.
But we used to be our vaccination quota was.
No, every town is individualized. All data is individualized.
Okay.
By
good.
town.
That's progress. Okay, thank you.
Any other questions? No? All right. Thank you, Jen, as always, for all your hard work on that. Bethany?
Hi, Beth, excuse me, Bethany Zorro, New Canaan Health, Human Services Director. Okay, so this month we are just continuing with Real and getting the cards out, doing as much type of outreach we can with it. And I will have a meeting for reassessment in June, and I will give you that information as well in terms of what the quantitative look is looking like in terms of the number of hits and what areas, things like that. Behavioral Health Alliance, we are in design phase and working very well with Community Foundation, Silver Hill Hospital, and Laurel House. I think we're going to have a pretty good launch date. We're looking for the soft date is mid-April for those that we will put it out to look at. And then May 1st for Mental Health Awareness Month, we'd like to have a full launch. That's the game plan. Schoolhouse Apartments, we do have the beautification project is underway, and as well as the Human Services grant payment process is updated. It's a memorandum basis now. So I went Tuesday in front of the Board of Selectmen to get the remaining quarter of payments out for fiscal year 24. And I'm in the process of doing the Get About grant application. This is the 4-year grant application that we should be able to get it successfully as we have in the past. And let me see, I presented at an Aging in Place series at the New Canaan Library for Staying Put last month. And our referral topics continue to be the medical needs, hospice care, housing, bereavement, choices, and a lot of other phone calls that come in. The major one is Adult Protective Services. We're seeing an uptick, which is good. The word is getting out, and the police are working closely with us in terms of coming to us and helping direct them and get them used to the process of their mandated Adult Protective Service obligations as well. They're wonderful. Blood pressure clinics remain. And then I have the series of events and trainings that continue on. There was a wonderful New Canaan Cares presentation about reducing teen mental health stigma at the high school last month. That was packed. It was standing room only. It was great. So it was good to see that interest, the abuse prevention. Yes.
Who was at who attended the New Canaan Cares presentation? Was that parents, children, or both?
Anybody. No, it was not children.
Okay.
It was parents
Okay.
and those interested. And the panel was excellent with Kids in Crisis and the head of student services, Susan Bliss, the head of counseling, and the Tracy, who's a private practice counselor, as well as a Silver Hill consultant. It was excellent, excellent outreach and response.
Thank you.
So then Marcy and Jackie, the caseworkers, you can see that they continue their helping the community with definitely an uptick in urgent assessment type issues, as well as adult protective services going out, and we're taking care of those. Those cases take a while. There's process, there's protocol, there's human rights, there's everything, and we just want the most positive outcome possible. And so we do. Stanford Department of Social Services is our catchment. We are in their catchment area, and the caseworkers are excellent. They get about 8 adult protective service calls a day, and they only have 3 outreach social workers. So what they have to do, they do have to triage a little. And as a result, it's within 48 hours, they will get to us. But they definitely have a heavy workload as well. So in terms of the budget, pending approval, but that was done last night, the in reference to our expenditures, I'm just focusing on the human services agencies. The final Board of Ed to town council, and then town council, you can see, did pass the final budget for our human service grants. As you can see, the 8,000 from New Canaan to New Canaan Cares and the 25,000 to the Urgent Assessment Program. That going into next year's, which I know is another topic for 26, fiscal year 26, you know, this shows us the road that the commission is on in terms of looking at this grant process. What's the best way to do this? Should the grant process remain as a grant process? Should it become an allocation, an allotment by the town, and then we work with the money that is given to us? I mean, this is up to you, but I'm just pointing out, we will not have the opioid settlement next year to be able to add the additional 10,000, which we are this year, for New Canaan Cares to bring it up to 18,000, as well as the New Canaan Urgent Assessment Program, 25,000 from the opioid settlement will bring that up to 50,000. So this was backed out after the budget was accepted, and backing out the monies that are not coming from the taxpayers. That's a challenge. That's a challenge looking forward. So maybe, you know, this was a time to reevaluate, see how you want to move forward, and just notes. Just notes taken on that. And then human services,
So Betsy, that is complete
yes,
for this.
yes.
So her work is then going to be, how do we start our process in evaluating needs of town and then come up with our recommendations for next year, knowing that it's going to be a different
A different
financial
atmosphere.
situation, maybe a different process that's beyond us.
It could be, or maybe to have, you know, partake in what it should be.
Right.
But definitely this was the year, it was stated in a lot of the budget meetings. It's a year to look at everything philosophically as well as budget, quantitatively, qualitatively, bottom line. And what we did lose, what we tried to go for, and we definitely, a compromise was made. The teen talk counselor at the middle school at Saks will no longer be after June 14th, which is the last day of school. And as a result of that, the compromise is that the Board of Ed will pick up a counselor and have them at the school that will function in some way like the Kids in Crisis in terms of the confidentiality issue or freedom of. But definitely that they are concerned. It was definitely a valued part of the Kids in Crisis, was a valued part of the environment. And but they do want to make sure that the kids do have some type of access of mental health free of any type of.
I know it's to build on what Peter's saying, I know it's later on in our agenda, but I still always go back to our charter, right? Our charter is to make recommendations. And so if we feel that there is a need and demand for a recommendation, and we talked about setting priorities, then we make that recommendation. If the Board of Finance and the first selectmen say, okay, we appreciate it, however, we only have 200,000 this year, and they come back to us, then we'll make that appropriate adjustment. But I don't think it's up to us to take, okay, we have 200,000 to spend. How are we going to spend 200,000? I think it's more appropriate to follow the charter, which is to make recommendations. If those recommendations are 100,000 or it's 300,000, then that's what that recommendation is. And so I just want to get back to that and get out of the politics of, you know, ebbing and flowing of what's going to be pushed through or anything.
Yeah, and I think our work is a process that sets up priorities where there's a lot of thought that goes into a systematic way of coming to our recommendations. And that's our work over the next, we'll start it today. Thinking about it, but we'll develop that process so that next year it's gonna be along the lines of what Russ is talking about.
And the financials, I do get the financials during the year, which
Yeah.
support the why we use them or and it's the numbers of being in human services numbers. It's an help per individual. It's helping. We're not looking for the biggest bang for our buck. We're looking at who's helping our residents. So that being considered, I don't want any organization to be lessened because based on a number. It's a value, intrinsic, qualitative as well as quantitative. So that being said, well, for your discussion, but just wanted to put it in there. And human services data, you can see this is just first quarter for year to date 2024, but the 2022 and 2023, obviously a full fiscal year. Our food pantry clients served, we are getting back up. We went down in February, which has been usual, but then back up again for March. And what we're finding is there are a lot of people that are in flux right now. They're having some type of life quake, which I call it, to where they need assistance, and it may be for 6 months. Maybe, they're finding a job. Their marriage situation is changing, things like that. So their finances are changing. So we're noticing that there's some short term, hopefully, but we're there for them. So we'll see what happens during that. And then the urgent assessment program. You can see there was a update. We had an alliance meeting, and these are the updates from Silver Hill. Basically unchanged in terms of percentages and what they're seeing. Obviously, anxiety and depression still rank in the top 2 for presenting complaints. Substance misuse has gone up a little, but they are definitely looking at that more and trying to get a clearer picture in terms of how people present. And then the actual is sometimes higher, but they're trying to zero in more on the substance misuse, which is a new name versus substance abuse. Yeah. Just going with the lingo. That is it for me. If any questions?
Commissioner Barksdale, I just want, and thank all your staff for all the work that they do, as well as can you, with the databases that you have, separate out kind of the increase in low income housing that we're trying to, or affordable housing that we're going to try to do as a town to our numbers and our stats? Is there we would assume there's a direct correlation between affordable housing increasing and, food pantry, or maybe, yeah.
Absolutely. There is a correlation with it. As you can see from the addresses of the clients, this is where they're coming from. Their addresses are New Canaan Canaan Parish, Millport Apartments. There's not really affordable low-income housing private in New Canaan.
Well, agree, but
So when people aren't coming into the town, they can't afford the rent unless it is affordable housing.
well, let's take the food pantry just as an
Yeah.
example. Is the food pantry directly related to the increased number of affordable housing units? Or conversely, we don't screen someone to make sure that they're a New Canaan resident.
Yes, we do.
We do for the food
We
pantry.
have to, yeah.
Okay, so excellent. All right, so
Yeah, we have,
then you see a direct correlation with the number and utilization of food
100%.
pantry. Okay, thank you.
100%.
Thank you.
Thank you.
Do you have data on that, or is that just an impression? Tom Ferguson,
Yeah.
do we have data on the addresses of people coming to the food pantry?
We have every address of every person and email because we do send out information. And it is, I would say, 95%
Of
Canaan
the
Parish.
change? or
I
the
should say
total?
95% Schoolhouse Apartments, Canaan Parish, and Millport Apartments. There's really, yeah.
Of so month to month, if you look at the people coming to the pantry, the great majority are from those
Absolutely.
three communities.
They have to qualify, and you do, right, exactly, and those that are
And to
qualifying.
qualify, roughly, what is the qualification? Simple.
So we take the person, family, the situation into account, the whole situation. And as I said, sometimes it's temporary, someone's out of a job a little bit, most of them, they are already in affordable housing. It's expensive to live here and to maintain a job, you have to really be making a lot of money. So that is short, that we have less people, we have more people on a long-term arrangement. And they are, as the food pantry does, it doesn't feed a person completely, but it bridges a gap between the SNAP that they're most likely receiving. And that's, if you qualify for SNAP, you qualify for the food pantry,
Mhm.
as well as their earned income or unearned income. Those that are on a fixed income, Social Security, disability, things like that. So we do see, we definitely have our clients long-term and our short-term clients, they seem to be increasing a bit. But the last thing they want to do is go to a food pantry, so for them to be able to need it. So the situation we look at is, we look at the money coming in, the money going out, what they're doing as budgeting, how they're helping the situation. Do they have children? Is this long-term? Is this short-term? If it's long-term, we see a disability could have occurred. And now they have to wait 2 years to qualify for disability, things like that. We want to help them. We want to help them stay in New Canaan if they want to help themselves. So then we put them in touch with other resources in terms of getting a job or working with the state on other programs, things like that. So in terms of qualifying, if they qualify for energy assistance, they automatically qualify for the food pantry. So you just can't come in and say, I need food this week. We want to know why, because maybe we can help them even more. Mhm.
I mean, to build on what Tom said, Commissioner Barksdale, if you look at the food pantry in your stats, if you look at energy assistance in your stats, there it seems like a direct correlation between the increase in affordable housing units. But I also would want to know, is domestic violence cases related to that, if you could separate that out, or suicidal ideation, those types of things.
So
Is
we're
that
not
could be bring-
assessing for, if we're assessing for a suicidal crisis.
Right.
We're not assessing in terms of mental health and getting that involved. That's not included in a financial assessment.
Yeah,
But
it just leads to, when we look at our grant money or we look at resources, being able to target it better, right? If
Mhm.
it's in affordable housing units, how do we target that better as compare, is it something that is just, New Canaan stress, type A personalities in our lovely, beautiful town, and addressing that
Yeah.
as an example.
So that's public health education more,
Right.
and it's like what Jen's doing and getting the word out and reducing the stigma. So that being said,
Okay.
it really is the correlation between the public housing availability and those that are coming into New Canaan and a wonderful school district. Being able to afford to live here and taking advantages of the assets that we have. And the only way to get into that is, the public type housing, which we have a shortage, but so does the nation. This is nothing new. This is not just our town.
I do think there's gonna be a step function in our knowledge and awareness with the work that Community Foundation is doing,
Mhm.
the survey that will be kicked off either late summer or early fall for the first time, getting real comprehensive data, survey data from the town. We're just gonna know a whole lot
Whole lot.
about all of these issues and actually have real data. And I think that's gonna be a really important part of our work this year. is, I hope you guys will be able to have some involvement in that, like questions you want answered and stuff like that. And then certainly the assessment of what comes back and then our priorities from that. I think it's really well set up,
Yeah,
given, what the
And
town,
that's
what,
what-
what town government is asking for us to be, more intentional with numbers and things like that. That
Uh-huh.
is gonna come, and I think that will really set us up nicely for some really rich discussions to start to get at kind of what Russ is probing at is
Yeah.
the prevalence of a lot of these issues, be a little bit more data informed. on
data
it.
driven. I do share, the New Canaan Community Foundation and New Canaan Cares receives our numbers too, to keep them aware.
Yeah.
For their purposes. And so that's very helpful. And then the opioid settlement. Thanks to you all, we'll be paying for this survey. That's going to be town-wide, not just public school system-wide, which is huge.
Commissioner McKenzie, I also wonder too, like if substance misuse, I doubt it's actually increasing. I bet things like changing the name from abuse to misuse has people more comfortable talking about it. And it's, I think, a testament to the work that we're doing in town, and we're gonna see those numbers rise.
Yeah, and we're trying to capture that more, or Silver Hill is trying to capture that in terms of the terminology. When kids eating edibles might seem normal to them, that's misuse though. So it's actually educating people as well, figuring, what's your interpretation of misuse or abuse? An older person drinking 2 drinks a night, that's like 4 at their age, so yeah. So, yeah. Okay, well.
What are you so?
So things like that, it's interpretation of when they're trying to define the question more and put a quantitative number to it. That's an objective versus subjective. So that's where it's at.
Any other questions for Bethany? Okay, then we can move on to old business, which is the calendar and meetings. I'll just remind everyone that via email, Dr. Pierce shared that he would like to keep the meeting frequency to monthly, but then decrease the direct reports. He said quarterly, so we can maybe use that as a jumping off point for the discussion.
Commissioner Barksdale, I'll just reiterate, I thought what we discussed at our last meeting, and that was from the Health Department, from Jen Ilson, that would be quarterly, but from Human Services, Bethany Zorro, that would still continue monthly, her presence here.
Yeah.
And I'm not to say that she has to do, the full report analysis, maybe that could be quarterly, but just to be able to answer our questions as we target some priorities, or, be able to go back and gather data for us and to support us in that way. I thought that was, correct me if I'm wrong, I thought that was the discussion and what the consensus was at our last meeting, but I'll bring that up.
Put that in motion.
Well, I wanted just to go
That
around the
was
table.
my
I think
recollection.
we kind of dipped into it, but we didn't get to dialogue and debate and
Exactly.
the nuance of it, because there's nuance in it.
Yeah, exactly.
But I think that's a great setup, and Jen, I know you.
That's fine. I think you pretty much covered it. I didn't feel like we discussed it or talked about it. The first selectman was very much spoke about that. And it's not that I don't think that Bethany needs to be here reporting to us every month, but I don't think we really talked about what we're looking for and what's the best use of Jen and Bethany's time.
Yeah, I mean, just for presence is one thing, right? And then the reports are something else. And we want to be, I think, smart about your sort of obligations, because monthly reporting, all the stuff is a heavy load. To me, and I get that. And so,
My
but for
feeling,
me, a
yeah.
quarter, like, because that's 90 days, and that's 90 days not seeing stuff, because things do flare up in this town. And I wouldn't mind seeing reports every 2 months, maybe, not every month, so you're.
Were we talking about not getting a monthly report? Because I thought that we would still get the numbers every month. What it is the sort of hour and a half of their
Right.
time
Well,
in
what
this
I had
meeting.
said is I would send my report. I just won't be here, which is what Deanna agreed with, that
Yeah.
I have way too much on my plate.
Mhm.
And that was
Yeah.
the agreement.
Yeah.
That I will still send a report, you'll still know what's going on, I just physically won't be here every single month.
Right.
But you would be here quarterly, right? You're okay with that?
Mm-hmm.
And I would prefer to be here.
Mhm.
Oh, good. Okay. then-
For the grants and things like that, more hands-on individual. I know as Jen said, she has mandates. Uh, I have situational aspects which might help with decision-making, especially this year for philosophically and
Yeah.
working on the grant situation. But up to you, but I definitely,
Look, I think it's also managing the agenda, right? As we're getting monthly reports or we're looking at data and we see something flare up, that we put you on the agenda. So, formally know that come in and, we're going to limit, the perspective to this one item and really delve into it in more detail. I think that could be a better way to do it. It doesn't have to be regimented as quarterly. If we see a flare up and we put either one of you on the agenda, just to talk about that one issue, maybe that's an appropriate way to allow you to, because you guys got plenty on your plate, right? And especially if we decide we're going to go after a lot of grant money to augment some of the grants that we're looking at, which is what we're going to be doing, I'm assuming. Never assume, of course, but if we want to go and if both of you are okay with a monthly report, and then we as a commission look at that and say, here's an item that we're interested in, we'd like to put you on the agenda just to talk about this one item as compared to having to give a full report on everything. If everyone, I'm seeing a nodding ahead, then I will make that motion to the commission that we still receive monthly reports. If we see anything that is alarming, we'll put it on the agenda and ask you to present on that item. But Bethany, if you could attend all of our meetings, it's just as a, collaborating.
I would like to,
As
yeah.
a collaboration,
Perfect.
then that's the motion that I put on there.
And Jen quarterly, to show up as the other piece of it, that we talked about last meeting. I think that hangs together. Well,
So that's the motion on the table. If Alyssa got that, I apologize for being a little
Back to the
little
videotape.
loquacious on that. I'm happy to write it and put it in.
Jen seconds, I second.
All in favor?
I,
And then I don't know if we need to discuss July and August, because I think there was also some discussion that we wouldn't have a July meeting and potentially not an August meeting, but then that cuts into budget season.
right now, July, I think the reason there was not a July was because.
Falls on the 4th
4th of July.
All we need to do is change the date.
Right, but there was some discussion, I think, that did we even need the July meeting because so many people are on vacation? I mean, it's worth,
It'll be 2 months without.
yeah,
right, so I mean, we definitely wouldn't want to do 2 months.
Yeah,
Yeah, so we,
so August off.
August is.
And then
I
we
would
revise.
cancel the August meeting. I think more people are away in August.
is that a motion? Formal
Yes.
motion,
Yes.
Tom?
Yes, that's a.
Then I'll second the motion that we take August off with the provision that we reschedule the July meeting with notice.
Perfect.
And all in favor?
Look at this, your chair for a day and you're already. Man.
Better than Congress, okay.
Well, that's not
Exactly.
saying much.
Oh, a low bar.
Very, all right. New business then is future finances and function and commissioners' cognitions. Mine aren't great. So one thing that we had discussed too was looking again at our top 3 priorities. And seeing how they compared to when we did this exercise, I think it was last year. And then I'll remind the commission that Dr. Pierce thinks that the commission needs closer involvement in data with regards to grant functioning, which he emailed.
Well, there's Commissioner Barksdale again, there's no question after what we went through this past budget season that we need to have a tighter process and a more exhaustive process on setting prioritization and substantiating the amount of money that we're wanting to give. And I think that goes across the board. But again, it's a recommendation that we're making. If the town Board of Finance, that's why the process is set up is the way it is, right? The Board of Finance then comes back and says, this is the amount of money that we're allocating. But as much substantive discussion and material that we can put behind why we want to do this and why we want to spend the money and what needle that we're trying to move from a health standpoint, a community health standpoint, I think it makes it more difficult for a commission to say, no, we're not willing to support that financially. So I think the onus is up to us when we make the recommendation to have thoroughly flushed it out and supported it with data. And that's, that's us. That's our charter,
And I also think, just to add to that, the monitoring
100%.
of the monies that are being spent and to upgrade that. And one of the suggestions I had made was to support Bethany, we divide up and have kind of side responsibilities, keeping an extra eye out on each of the grantees. So that that's the resource along with Bethany, especially like on the financial side. And I think First Selectman was really strong on that from a governance point of view, which is very consistent with everything that you're saying, because I do think that setting the priorities piece, which is an iterative process, and I think we're also tasked with keeping track of things that are emerging, things that are quiet but starting to become something maybe more significant, and then also identifying the gaps. Also, I think a key part of our of our work, because it's not going to be the same priorities all the time.
Agreed.
And so I think if there's a specific thing around the governance thing where, each of us takes on small responsibility, which would be really interesting and would deepen, I think, all of our understanding of the community, would be a piece. And then we sort of set up a process to systematically start gathering data, getting the right people in the room that we can talk to and interview. So it does wind up being more robust. So when the money comes up toward the end of the year, we've been really intentional about gathering knowledge, working super closely with our brilliant, partners, Jen and Bethany.
And
Have
Pete,
a really nice process.
and to that, the numbers are there, and I do get quarterly reports, monthly reports, depending on how their financials are set up. I've usually just pass it on to the chair, but I can easily pass it on to everybody, or else if a couple people were assigned to each organization, agency, working with me and seeing what the yearly outlook. So when we do have guest speakers, or when I do present the recommendations, there'd be at least one or two people on the commission that can talk about it from their perspective and following it for the year. I think it would be great.
I would, this is a great discussion, and my motion would be to share, and none of us have time to have our emails, balloon up, but certainly I think the first round should be we share it with everyone, the data and the information, and that will give us power for our discussion to say, okay, how do we want to cut the elephant up, and who wants to do what and report back, and who wants to track and review. I think that's the appropriate way to do it, but without knowing all the data and all the information that you have available to you, data is important to me, at least in making decisions. So I'd want to see it all first, and then try to trim down, and then say, here are our priorities. But that's where a master, I think, calendar and a master agenda would be extraordinarily helpful, to say, in this month, we're going to do this. By this month, we're going to track it down, and then we're going to really hyper focus, I think is Peter's term, hyper focus on those 2 or 3 items that we're going to try to move the needle on, and what resources that we need to provide to do that. And I think that's how you run any business, right? And I think we should be more regulated, if you will, in terms of looking at that cycle, if you will, for the next year.
Mr. Lisher, the problem with working for the town is it's not a business. And part of the problem is, or part of the opportunity is to build on what Peter's saying, what you're saying, in terms of, and the general sense of the administration of the moment of having a data-driven mission statement. Net is that part of the, or the major focus, as far as I'm concerned, of this commission is defining needs and addressing those needs and making sure that we're covered in health and services, which we've done a wonderful job of. I was looking back into ancient history, meaning 2008. We combined with the commission combined with the foundation to run a major study of senior needs. That actually, the first big action thing that came out of it was the birth of Staying Put, frankly. The second thing that came out of it was a request from the Board of Selectmen to actually look at senior needs for the next 10 to 20 years. We put together a group of combined commission people plus volunteers. Many of those volunteers went on to become members of the town council and Board of Selectmen. So it was a way of getting seniors built into the woodwork. But I wanted to throw out some specific ideas to have people think about more than take action on at the moment. But I wanted to point out to the fact that that data is the derivation of action. And that's, and action is a major part of what our job is about. So it's, at this stage of the game, I would say that the foundation is clearly in the leadership position. However, we've got Bethany and Jen heavily involved in behavioral health also. So I'm not sure we need any more studies from the commission on that, but I'll give you a couple of quick ideas of what came out of this in the past that created action. The first thing that everybody should have that seniors were growing, but were not a very important part of life back in the turn of the century, as it were. But key thing is that there's an opportunity down the road to update this study because it was done in 2010 and 11 for the next 10 years. Guess what, guys? It's already been 10 years. So there is a possibility that I don't think that there's great unmet needs of the moment in the seniors area. But the fact is it's going to continue to grow as an important part of our quality of life of the town of New Canaan. And so from the standpoint, I'm not going to belabor, but we could think about updating a senior study or of some version of a demographic study. Second thing, coming out of the 2010-11 were a number of actions, one of which was to put 23 benches out on the major walkways of town. Those benches went out in 2011 and 12. This commission generated public support for that by getting each of those benches paid for by the public, and it's time to probably refurbish that. If we wanted a specific project to bring this group together, that would not be painting benches per se, but organizing a community thing with slobs or Staying Put, or I'm not sure who.
Boy Scouts.
But there's plenty, and Boy Scouts, there's plenty of labor, but we need to get that done. And again, those benches are beginning to go somewhere in there. So that would cost nothing. We get the free paint from the town and et cetera. So we turned in, as you know, two grant requests for our major health innovations in town. Russ's telemed operation at Waveney and the New Canaan urgent assessment. I was amazed when I went back to look, we are not considered a livable community by national standards. So one of the things that I'm going to bring up at the next meeting is how to fix that. But more importantly, the main thing that always precipitates action in this town is comparing us against Darien, whether it's for a library or a football team. And I was amazed to see that Darien outscores New Canaan in the AARP National Livable Community Scores. So I want to begin thinking about how to fix that. Because we should be in the top 100 communities in this country. I mean, realistically, we all believe that. But there's, when you have data, you can manipulate data, as we all know, in a number of ways. And clearly, nobody's ever from this town approached that AARP national ranking. And I suggest that down the road. But that's, again, a job that doesn't require any kind of cash but time. And finally, I sat in on the Silver Hill Silver Hill Grand Rounds on a monthly basis. Coming up at the end of this month is a presentation by Silver Hill, a panel at the library, I think it is, that's going to talk about loneliness. And basically, one of the loneliness experts in the country lives a few miles away from here. And so from the standpoint that the Surgeon General of the United States has declared loneliness a major problem, an epidemic, if you will. Now, loneliness doesn't show up on the urgent assessment thing, interestingly enough, directly, but I can tell you from listening to the Grand Rounds presentation and the realities that we know, that loneliness has a lot to do with a connected mind and body. And so anxiety is a direct. So at some point, I want to personally begin looking at what loneliness is as a potential project. Not as something, again, to spend money on, but to generate some data on. So I throw those 4 ideas out. One, which is I don't think there's a need for a new senior study yet, but that's something we should be thinking about down in the future. I want to become a livable community on national standards, and I think that's just data manipulation and spending some time thinking about it. And we can always do more for seniors, including paint those benches. And I think that's a great way that would take us all out for one day, basically, to each pick up maybe 3 or 4 benches of the group and a task force that the commission would recruit to actually man the brushes. No, nothing wrong with manning the brushes yourself. Anyway, I don't know whether you want any kind of discussion of the moment. I throw this out kind of as bread on the water to think about, because I totally support everything that we've been talking about and the general sense.
I mean, I think they're really neat is, and I do think us to put together the framework is important. Like, as an example, like the monitoring of the organizations, I'd like to just close that out with saying, by the next meeting, I think everybody should think about what they might be interested in. I mean, someone will have to coordinate sort of all of
I like that idea.
And then let's come in and just assign that, I think that's sort of a good,
Yeah.
a good next step.
I had a question for discuss on the budget.
I'm sorry, did we just motion
Sure.
that?
Yeah,
just,
go ahead.
Yeah, I
so-
just want to add to that just a little bit. We went through the process of, I think, before your time, of course, but of identifying where we feel, because we all have come with a different perspective, right? Of our top 2 or 3.
Right.
And I think that having an entire meeting scheduled with us having that active debate
Yeah.
and discussion, there's a prime example of coming to a meeting and saying, here's
Right.
3 things I'm going to throw out, and having a discussion that we all then look and make a recommendation that here are the top 3 things that we'd like to focus on. It'd have to be 3, could be 2, could be 4, whatever that number is. And then we start delving into the data and what we can really do to make an impact. And what are those nonprofits that are in town or not in town, and how are they supporting? And can we meet with them and bring them here, share with them our concerns, and ask them to say, this is how we can meet them, this is how we can't meet them. And that will help drive where our dollars are spent and help drive what priorities and communications we're giving to staff. So I just want to build upon that and use that as an example, but have the entire agenda for our meeting to include that.
So I'll make a suggestion on that. I would suggest that each of us by ourselves come up with our list. It could be 2, 3, 4 priorities.
Yep.
I would say maybe rank the top 5 or top 4. And somebody compile that and spit it back to the group anonymously, so that the problem is, if we're sitting here and one person says, well, I think these are the priorities, then everybody wants to agree with that person to be, a good guy. But if we independently think about it, come back with our priorities, that's a little more revealing. And it would be a great start for discussion. I would recommend that we do that for the May meeting, or if we have it.
I'll just add to that, from a FOIA standpoint, I think if we make that email that goes to Bethany and then Bethany shares it to the entire group, I think that would be an appropriate way of doing it. As long as we do not respond to it, all of the responses that we have in discussion should be held during the meeting and not sidebar.
So maybe we motion that we try to decide next meeting on who will be covering which organization. People do their own homework on that. So I think we can go around the table and do that pretty quick.
Yep.
And we everybody try to submit these priorities to Bethany, and we make that next meeting real discussion about that. And
I think
and we can get Bethany some support
sure.
From a couple of us in terms of gathering it all and how to present it and all that sort of stuff, because there's a little bit of prep to have a good discussion in terms of how the
Right.
material is presented. But this is like, we can get right on this for the next meeting, because once we have a sense of priorities, things start to flow from that.
All right, so what I'm hearing, number one, if you want to look on the budget, these will be the agencies that everybody wants to send me their top 2, and then I can formulate, as well as your top, 3 or 4 you decided topics, and I will just consolidate,
Yeah.
and I can send that all to you.
Mhm.
And then you can take that information and go with it.
Raquel Harrison, I think one of the things that I often come to in thinking about where to get involved or what is the underlying why. And so I would just encourage people, as they think through the organizations or the topics and priorities that they're concerned about or want to be more engaged with or dive into, is the underlying why. I think the thing that often comes up for me is there's a big mental health crisis. We can have a lot of mental health solutions. The peel back of that is, why do we have a big mental health crisis, and what are the solutions we can be tackling in that space? And so, my background's in emergency medicine, but also lifestyle medicine. And so that more preventative, tackling the underlying, like what is leading to all those emergency visits is really, really key. And so I think as we break this down for ourselves, doing it with that lens changes the conversation dramatically, hopefully, right? In a more practical, like granular way.
I want to add one quick thing, though. One of the things that ties these 4 ideas together is energy within the commission itself. Because we all get together once a month, some of us more frequently, but ostensibly you need a project every once in a while that's what I call a soft project. Basically, that sort of gets everybody together to get acquainted, but also provides some kind of evidence in the community that this commission exists, because many people, part of the reason we did that 2008 study, nobody knew we existed, including Vine Cottage at the time. So we were looking for ways, and so we certainly generated the business for Vine. helped along by COVID and the health department. But from a standpoint, I think we need to have a project that's easy to do. And I keep coming back, I'm not totally in love with the painting benches concept, but that's the kind of thing that I see as an opportunity to get us together outside this room. And
But
that's
yeah,
critical.
getting to why and having specific programs, I 1,000% support. And that's how, if you want to know how you make a difference and how you're known as a commission that made a difference, getting to the why and having direct programs and looking at suicidal ideations over a period of time declining, then you affected the why, right? Doing it on the back end to support the emergency department, it's too late at that point in time. You're looking at trying to have something intervention and getting early, and what are the signs and what are the stressors that are occurring. I think that's the right approach.
Sorry, just to jump on that, New Canaan Cares actually tonight is having an event, hosting a guy speaking about social media and its perils, right? Max Stossel. They have over 450 registrants. This is a really big deal for our community. There is a community group of parents, I do happen to be on it, but who are creating an organization loosely, a community group really, to try to continue that conversation.
Yeah.
Right. And so those are the kind of things that I think almost too with that why is, are we diving into some of these agencies of these are also the specific whys that we're hoping to support, or that's just an example.
Right.
But that idea of you can kind of take that next layer.
Yeah, it's a great point.
Yeah.
I also think we have to realize this is going to be iterative, because the why is super complex, but this is, we need monthly, and we can keep bringing other folks in and trying to get a subtle understanding. But for me, just starting the process of, because I think we probably know generally the bucket of categories, but just even aligning on that will allow us to start going deeper. But it's going to take some time, even frankly, the whole year, to come out with a really refined understanding. But your why point is so important.
So let's try to
You
be,
don't want to fix the
So-
symptoms. You want to.
let's try to be very, very specific in our recommendations. I think that's would help us get to a why. I mean, we think about, your point is excellent. You think about social isolation for seniors. Well, why did we get to the social isolation issue? Was it kicked off by COVID, or is it kicked off by being a widow or a widower, or something else that's going on? And who is providing services to someone that's socially isolated so they don't develop other issues like substance abuse or, suicidal or anything else? If we can get to that core, then I think, you're going to see the needle move on so many other health factors that we're tracking.
And I want to add the behavioral health survey that we're doing. I think it would be great. I know the foundation is going to be doing it, but maybe we could have a liaison. So one of you maybe Peter. But to be-
Thanks for volunteering.
Yeah, I know, but to be a
You're in.
liaison for the commission,
No, but honestly.
just a suggestion.
We should have Lauren come in front of all of us to talk about this, because I think everybody needs to hear how she's thinking, and she needs to hear from us. I mean, I can definitely do a lot.
But
of
when,
leading,
yeah, and
but
when
that's not work.
when they decide on who they're going to be hiring to do this survey.
Yeah.
Then I think we'll have,
They haven't
You know the
made that
timeline on
decision.
that?
they haven't.
Bethany, do
Pardon
you
me?
know the timeline for,
Lauren had spoken about the fall, when people are back at school, back in town.
so it's a ways off yet?
It's a ways off, but
Findings wouldn't be until what,
oh,
end of the year?
I don't know. It depends on whatever firm they're using, their consulting
Okay.
firm.
The planning is starting
Yeah.
now.
Now.
and which is really the goals.
Right.
Going to and
It's
all
gonna
those
be a
things.
while before we
Yes.
have a,
Well,
Definitely make sure
But
that the
nothing-
seniors, that we
yeah, okay.
cover these, we capture these aspects. So maybe
Okay.
it can
so
help
in the,
answer
in,
why.
in,
Yeah.
in the interest of time, can we set forth kind of specific agenda items that we want to cover and a calendar to that? So May, we want to report back to those and get a sense of priorities of what we're going to address.
And the agencies.
And the agencies, right?
That'd be
Then going into June, maybe we have Lauren, and maybe we have this a representative of the school nurses and reporting what they're seeing because, Waveney runs, not to promote Waveney, but Waveney Life Care Network runs the school nurses system for Wilton. We keep a tremendous amount of data that we have to report to the town on asthma, on a whole bunch of, domestic violence, on things like that, that we have to report. So that provides the town a great amount of insight in what's happening to the kids when the school nurse actually sees them with a bruise on them, or they have an asthma attack because they're not compliant with their medication or other things. So that's a motion I'm making just in terms of our timeline and agenda, so that we don't get too far down the road and find ourselves in October and November trying to, rush, put that through. So make it a motion.
Second,
All in favor?
thank you, Russ.
Uh,
I had a question about the budget and, it looks like the bottom line this year is 201,000.
Yes.
Yeah,
500.
and I would predict that the direction we might get from the powers, the elected Board of Finance people is, come up with a number like that or a slight increase next year. That's just a guess. In other words, somebody's gonna give us a budget and it's kind of up to us to figure out how to allocate it.
Every October, every department head gets the guidance from the Board of Finance, from the
Right.
budget director. And that's what the departments are supposed to do, their
And it's
budgets are
usually like
out.
0 or 2% or something, I
Right,
think.
I just want to, again, come back to our charter. I want to get away from just incremental. We gave them 8,000
Understand.
last year. We give them 8,100 because
I understand, but the way the process works townwide is you are given kind of a target.
you're given guidelines and you
Got it.
should try to abide by your guidelines.
So if we think that the needs warrant more spending than 201,000, a lot more, let's say, we have to come up with recommendations of how to find that money, i.e. grants or whatever, or some other kinds of cuts, I'm not sure what. But I'm anticipating that's gonna be the real life situation we're gonna have. We had it this year. I mean, we came up with a big number and it was cut back partly because we had new people in office who were new to the process and said, hey, that doesn't look right. But I'm anticipating that we're gonna have to come up with that kind of a number plus a small increase perhaps. And manage within that, or find other sources of grants or leftover funds that aren't being used or whatever. But some kind of way to pay for what we think is important. So I'm anticipate that's what we're gonna be dealing with. And the budget season's a little ways off yet. We don't need to do it now.
I think though that will be our reality. That
Yeah,
is-
I just
that
wanted
is
to
going
get back to
happen.
earth here. Yeah.
But
Yeah.
our unique role is to be pretty pure about budget aside.
Mhm.
What is our honest assessment of what the issues are in town, and we're that voice as part of and there are other folks who have different roles and voices, like balance and budgets. They're not asking us to do that. They're asking we're the experts over here on what the real issues are and what we think the needs are, and we'll be part of the educational process for people who are making the decisions, and knowing that this is going to happen, and we also know that life is reality and fiscal discipline and all that is a reality, but I
Tom-
kind of
Tom-
agree with Russ a little in that we know that's coming, but let's just stay focused on the issues which are so complex and trying to boil those down and do our best faith efforts to lay out the priorities as we see them and what things are coming down the pike that we ought to be all worried about. And that is going to be a huge service to the folks who will make the final
Right.
financial calls.
So Tom, what you said, that may be our reality.
Yeah.
But the urgent, I look at it this way, the kids' urgent assessment program, if we you just went on that reality, we never would have been able to develop that,
Right.
right?
Right.
We never would have been able, if we'd have gone on an incremental basis,
So we
we'd
had
been,
to find a way to pay for it.
we did.
So maybe.
That's all.
Yeah.
Commissioner McKenzie, maybe to your point, maybe we need to designate commissioners who are going to like aid Greg Riley and try to find other sources of revenue so that that's not a last minute. Hurry.
Well, as we're playing this out, 200,000 may be enough to focus on what we need to focus on. It may be more than that. I think at that point, I think you're absolutely right. I think we need to then say, you know, if we're going to be limited to 200,000, then we need to get Greg in here and Bethany, and we need, you know, target some grant money to assist and give them opportunities to address it like we did with the, you know, child urgent assessment program, going and finding those dollars after identifying the need is, to me, what our charter is about.
And the one thing I want to add to that is most of these organizations are already applying for grants. So for us to apply for a grant to use an organization it doesn't work. But Greg Riley does, when he sees grants that possibly could match the department, he does send them to me. Most of the time, the value of that grant, number one, New Canaan doesn't receive a lot of grant awards. But at the same time, I also know that these other organizations are already applying on their behalf. So this is where it gets tricky. But definitely, I will send you an email.
Having just written the national AARP grants with particularly the urgent assessment but helping with Waveney's telemedicine. I mean, I'm very proud, as you can tell, of what this town did in healthcare innovation. You have to compete for Greg's time. Part of the reason I put it before the commission to vote to support that application was so we'd be able to get Greg's time. So yeah, you don't just walk into his office and say, hey, I know you're ready to write some grants. Anyway, it's a very competitive business. I've had several meetings with other groups in town that are going through the same budget problems recently. And again, everybody says, oh, this is a wealthy town. Plenty of people will support it, et cetera. The problem is all those wealthy people are well-known. The lines are very long. And you have to lay the track. And as you were talking, Peter, you know, we're starting a year in advance for fiscal 26. And the other problem that we have, just as a point of philosophy, is human services. Health is a little more framed up in graphic data terms. Human services is a tough proposition, as when you listen to Bethany's monthly reports. We are making recommendations for spending money against Tiger Man buying tires for a snow removal or something or other. And so it's always been a difficult task to sell a soft outcome of town life quality for human services versus somebody selling tires, as it were. And so, but we've been very fortunate. And what makes this town really unique is the fact that we have this commission and this group. And it functions. It's going to be interesting to see whether it functions as well with, frankly, the budget cuts, because that's been a major part of why Bethany has been successful.
The only thing I wanted to echo actually is the word you used of innovative. I think if our town's going to qualify for any kind of grant funding, it probably needs to be fairly cutting edge. And so picking up on patterns that we're seeing
Yep.
from, you know, the data is going to help with that. But it has to be.
And the people in the individual companies, the nonprofits that we're supporting need help in that innovation. I would challenge you to say that, and I would say that we should be a resource for them as well if we choose that is one of our priorities. We can't do it all. We're breadth of nonprofits that help everyone. Sometimes they need to be focused because they're sitting there going, okay, we're doing this, and we need money to continue doing this. And if we can hyper focus them, be more innovative, more cost effective, more targeted, then I think you're right. I think we'll have a better shot at, even if we went to the state and said we wanted to do something that's innovative, getting those funds.
Well, that's been the success of the Silver Hill Urgent Assessment Program, right?
The success, that was the reason we got money for
Right.
telemedicine. It's the reason we received money to start a nursing school in
Right.
town. I mean, you have, doing the same thing over and over is not going to get someone's attention. Motion to adjourn.
Yeah, does anyone else have anything they want to add? I think that's probably a good place to stop. All right, motion to adjourn.
But before, I just want to compliment our chair for the day. Good job.
Thank you, thank you. Not permanently.
Reflected in the minutes.
Yes, exactly.
The minutes.
Can I make a motion? I second the motion. To thank you, Secretary and Chair today. So thank you.
It's all part of the grand scheme of the town council and.
Oh, one man show.
Stop the recording.
All right. Adjourn.